has been my role in the state legislature, and I will say that I have a great partner in crime in the Senate, Senator Ana Caballero. I know that she couldn't be here. She does have staff, but we both worked hand in hand together to make sure that we were able to have this type of meeting to be able to give our community the update that we will hear from the folks at Madera Community Hospital. So there is hope, I will tell you. And as long as I continue to represent this district, rest assured that the doors of Madera Community Hospital will open. And I will tell you why. Why? Because we got hard at work from day one to establish what is called the Distress Hospital Loan Program. And I'm very proud that I actually led the charge to develop this program to allocate $300 million, not just for Madera Hospital, but for hospitals across the state of California that are currently we are seeing here from the community. And out of those $300 million, $57 million were awarded here to Madera Community Hospital. So, to that end, 15 million have already been allocated as they're doing the work, the construction, and trying to get the hospital reopened. And so we're working very closely with the state agencies, with AAM, which is the managing now partner in the endeavors to reopen the hospital. And so just know that as long as I'm your assembly member, those doors will reopen, but we'll not only make sure that those doors reopen, that those doors stay reopened forever, so that we here in the Madera community have a hospital. I know my time is up, but in another future, I would love to give you guys an update on all the other stuff that we're doing to make sure that we have the local nurses that we need as well, and all the other resources that we need to achieve what I want, which is affordable access to local healthcare, not just in Madera County, but an entire region, because what happens in Madera impacts Merced and Fresno equally. So we all have to work together. I want to thank you guys for being here today.
I'm sorry, thank you so much. And you know what, thank you for fighting a good fight and making sure that the people of Madera were heard through your voice. Thank you. Actually, this time I'd like to take a little bit of a break to thank Lynette Lumley and the staff of the Coalition for Community Justice. If you can put your hands up. They've been involved in providing information to you for quite some time now regarding healthcare, and I just want to make sure that they're acknowledged for that. It's no easy feat to put on these forums and get everybody organized. And then I'd also like to introduce and acknowledge Baldwin Roy with California Rural Legal Assistance, who is also come with us this evening. Okay, moving on so we can keep on schedule. I'm going to bring up Arturo Martinez, who is here representing Senator Ana Caballero.
Hello, good evening. I'm Arturo Martinez, representing Senator Ana Caballero as your district representative for this area. Since July 2022, when Senator Caballero became aware of Madera Community Hospital's financial crisis, she has worked with all of you in the governor's office to ensure the hospital received the resources necessary to remain open and subsequently reopened. With the incredible partnership between Senator Caballero and Assemblywoman Soria, along with the governor's office, the Distress Hospital Loan Program was created last year in time to help hospitals remain open, or in the case of Madera, to reopen. As AAM has affirmed, the funding for the Distress Hospital Loan Program is vital to the reopening of Madera Community Hospital, when hopefully we can all gather together to celebrate the completion of the first miracle later this fall when the hospital doors reopen. Senator Caballero, along with Assemblywoman Soria, are championing for more funding for hospitals, healthcare programs, and healthcare education programs in order to expand access, create more healthcare practitioners, and increase the quality of public health in the Central Valley. Senator Caballero remains committed to working with the community, all of you, AAM, Madera County, Assemblywoman Soria, and all stakeholders to ensure that Madera Community Hospital reopens, stays open, and provides the highest quality of healthcare to the community. Thank you.
Arturo, thank you. Please thank the senator on our behalf, and please know that we always appreciate you showing up to Madera. I know you spent a lot of time here, and we see that, so thank you. Next up, we have Joel Gay. Joel is the Assistant CAO for Madera County.
I'll keep it really short because Sarah took all the time. I'm kidding. All right, so I know the Senator and Assemblywoman mentioned the distress hospital loan program, which is integral to why we're here today. But what they didn't mention was that they were also key in securing $5 million for this community. So we wouldn't be here today if not for that $5 million, as that staved off liquidation during the bankruptcy process. So I wanted to point that out. And I won't take up more of your time because I think we're all here to hear from the new team sitting on my left right now. But I did want to share though that for the past 3 months that we have been receiving regular updates from the team sitting on this table, and that we want to share that our impression is that, you know, it's not without challenges, right? They've been encountering many challenges, and they will continue to encounter many challenges. But from what we gather, there is every challenge has been met with clarity and purpose and the motivation. So while this is the beginning, hopefully, of a longer partnership between this community and AAM, we hope that you stay here for a long time and become really partners with the community in improving healthcare overall.
Well, thank you. We appreciate all those times that you have been keeping up to date on our behalf from Madera County. I'd also, again, like to acknowledge Supervisor Cecilia Gonzalez, because she, along with the Assemblywoman and the Senator, you know, they make a powerful group of women. And so they are as a team. And so I will make sure I just acknowledge her again. So thank you, Supervisor Gonzalez. I think we're almost back on track. Okay, now I'd like to bring forward Mayor Santos Garcia with the City of Madera.
Thank you, David. Hey, this is a packed house. Man, this is tremendous. Congratulate yourself. I'm very, very happy to see you here because that means we're interested in the reopening of our Madera Community Hospital. And I appreciate the invitation to be here today for the Madera Community Coalition of Justice and AAM for inviting me also to be here. I want to give you a message of hope. This is a message of hope from the city of Madera. We're going to make this hospital reopen again, and we're going to bring back employees, everyone that cooks the food, that washes the dishes, that is taking care of us as a nurse and doctors in the middle of the night. We're going to bring it back. And I'm very, very thankful that that's going to happen. I bring you a commitment from the city of Madera to be your partners. We will be your partners. All you gotta do is ask. If you ask, we'll be here. I got calls from a lot of different people who used to work here and want to come back. They want to come back. My daughter worked here, and she's the first one that told me, Daddy, I want to come back. Well, there's a lot of you that want to come back. I've heard from several of you today. And so there's a message of hope. And I want to extend to you our friendship and to develop a relationship so that we can work together. That's our commitment.
Muchas gracias, Mayor Santos Garcia, and thank you and the council also for your continued commitment to serving Madera. I'd like to thank our next speaker in advance because I know she arranged her schedule to be here this evening, so it's very much appreciated. So I'd like to introduce Nicole Masteda, who is the Chief Strategy Officer with Camarena Health.
Thank you very much, and thank you for including Camarena Health in this. And we have, Karen, you have done a lot of work. I want to just thank Karen. I don't think we've acknowledged the work and commitment that she's done from the very get-go, the minute it closed. in the week before leading up to it, keeping us all in the loop so that when we saw a challenge, we could figure out opportunities and partnerships and way to collaborate. So I wanna acknowledge Karen. I also wanna thank each of you for coming in to our community and to be a support to so many of us in healthcare. Although we saw challenges, as many of us did in the very beginning when the hospital closed, I think we saw a lot of opportunity, a lot of collaboration, a lot of innovation that came through our partnerships. And it's really just allowed us as an organization to bring on new opportunities for our patients here in Madera. And that will continue when the hospital opens, and will continue with collaboration with the hospital group as well. One of the things that I'd really like to highlight that Camarena Health has really just seen as something that has been very beneficial, and will continue, and we continue to grow it, is our specialty clinic. As many of you know, our specialists, when the hospital closed, finding a home for them and keeping them here in Madera. So our patients wouldn't have to commute as much. And so we're proud to share that we have a full running specialty clinic with a diverse range of specialists, including general surge, GI, cardiology, pulmonology, infectious disease, podiatry, urology, geriatrics, and we'll soon be adding sports medicine, pain management, and oncology. And that's all here in Madera at our 6th Street location, so that the patients continue to have access to that care. Another area that we've continued to really try to uplift is our OB. And as you know, it's very hard when the hospital closed to not have a place to deliver and a place to support our moms. And so OB was a priority for us. We've been able to hire new OBs to be located in our Chowchilla, North County area, as well as here. We've also partnered with Valley Children's Hospital around with OB specialists for maternal fetal medicine and their medicine team for gestational diabetes. And we've been able to expand that 3 days a week, that partnership in our health center, and working with those so that the moms can have access to that here in Camarena Health. Our mobile health team has been deployed out to communities to make sure that they continue to have access when there's lack of transportation. We get calls regularly, and we'll continue supporting that and supporting our partners that we collaborate with to make sure that care can be brought out to them. And lastly, the expansion of urgent cares. We're now at 5 urgent cares. That was a huge need after the hospital closure, was to make sure that we had urgent late night access. And so Chowchilla now has an urgent care. We have 3 here in Madera, here in Madera, 2 in the city and 1 in Oakhurst, and then now 1 in Fresno. So I want to thank you all for your work, and we're excited to hear about the opportunities we have to continue to collaborate with each of you.
Nicole mentioned Valley Children's Hospital. I'd like to acknowledge one of the guests here this evening. That's from Valley Children's, Tim Curley. Thank you for being here, and thank you for all of your helpers. Nicole, thank you to Camarena Health for continuing to expand healthcare services here in Madera. Hello, neighbor. How are you? Good. At this time, I'd like to bring forward, representing many of our local physicians, Dr. Mohammed Ashraf.
Thank you very much. I'm going to take about next 15 minutes. So just be, no, I wouldn't do that. So, as a physician, I've lived in this town for 43 years. Much older than some of the people that are born, here. Number of our physicians are in the audience. We have Dr. Rajpal, we have Dr. Akhtar, we have Dr. Rebel. We got hurt the most. Every single patient who dies, and I've lost about 50 of them in this year and a half. It hurts us. And we're really waiting day and night, and especially me, because I'm right in the parking lot. I see the hospital closed every day, and it's very difficult. So I just want to assure you, and that we're going to support this group
who's coming in and helping us. And we the physicians, we are part and parcel of this community. And we are available. Some of us left, but most of us are here. And we're trying to recruit more physicians. With their help, we're trying to get more specialists than what we had before. So again, we are here, we're not going anywhere, we're gonna work very closely. We had some meetings with them already, and we are trying to formulate how the new staff we get. Do we have to have, what hurdles they have to do, privileges and all that. But they're very cooperative, and I think they do a good job, and I have all my full support on the behalf of my physicians. Thank you.
Thank you, Dr. Ashraf. One of the messages I'd like to give on behalf of the Chamber of Commerce is we don't probably really know and understand how fortunate we are to have the Dr. Abels, the Dr. Akbars, Raj Pauls, and Dr. Ashraf here in Madera, because you know what? They chose Madera. So it's time for us to continue choosing them, but they have chosen to spend their life and dedicate their contributions to the greater community. And so for that, I thank each and every one of you. And I'm a proud person who actually takes care of all of my health here in Madera. So I am very, very glad. Not that I've had to go to the ER for anything, and I don't anticipate it, but I'm excited that they will be nearby. At this time, if you could all please stand. To our panel from AAM, I would like to introduce you to Madera. And thank you all for being here. You can now be seated. And now for the highly anticipated portion of our program, I'd like to introduce Karen Palinelli, who will introduce folks from AAM, and they're not on a time limit. So with the time card keeper, you can put those away. After their presentation, we will go into Q&A. But first, let's hear what they have to say. And I hope that any questions that you have will be of excitement and curiosity. Karen?
Thank you very much. And good evening tonight. And it really is great to see all of you here in the audience tonight. Many of you I know and have worked with you. I see a lot of our doctors here. I thank our doctors for being here tonight. I do want to thank Baldwin Moy and the coalition for Lynette, you guys organizing this tonight. I mean, honestly, Lynette, she's came out to the hospital many times with her group, really working through the closure of the hospital and getting us to this point. So thank you for your support. Really appreciate that. There's many people in the room, but I do want to acknowledge the employees that are here tonight. This has been really a terrible time for our community. I live in this community too. I grew up here. I grew up at the hospital. I mean, I started working at the hospital, I think I was 19 years old. And so it's really dear to me. I wish, but it's very dear to my heart, and I know it is to you, and I know how devastating this has been for all of us as a community, but I'm here tonight to tell you that there's really great news. And before I introduce AAM and tell you about all the great things that are happening at Madera Community Hospital, I do want to acknowledge Esmeralda Soria and Senator Gaviero. And I just want to thank you for the work that you've done. You made a difference here, and I so appreciate it. So thank you. I do want to. And I also want to thank the county, the board of supervisors. I mean, when we were so desperate and we thought that we were going to go into liquidation and we were never going to get this hospital open again, but you guys stood by us. I know it was tough. It was tough on all of us, but thank you. We really appreciate Joel, Jay. I don't know if Jay's here, but I tell him thank you, and I also got to acknowledge the board that I worked with throughout the time of the closure. And I know that a couple of you are here, Deidre and Stale and Monty. I don't know if anybody else that was on our board, please stand. I mean, we wouldn't be here today if it wasn't for all of you. Thank you. I appreciate it. And I know, we have a new board now. We have a couple of the same board members, and they are going to introduce them. But again, I do see some of our volunteers that volunteered at the hospital as well. I appreciate those volunteers. We can't wait to have you back. And again, from the bottom of my heart, I appreciate everybody here, and Madera was open for 51 years before we closed, and we will be open for the next 100 years with the great work that's going to be done. And now, I want to talk about this amazing group of people here to my left. I tell you, they wanted to reopen this hospital from day one. It took us a while to get there, but I want to say that, our board, we made the right decision. These guys are amazing. I mean, everything that they told us they were going to do, they have done and more. And they are transforming our entire hospital and doing some things that were so desperately needed, but we just did not have the money to do it. I can't say enough praise about, Dr. Singh is not here, but AAM, the team, they're gonna have a little slideshow here to show you and showcase the work that's being done. We will have an open house, ribbon cutting, and we hope all of you and more come to celebrate with us this, great event that's coming. So right now, I'm going to introduce Matthew Beeler. He's the Chief Strategy Officer for American Advanced Management, and he will then introduce his team, and he has a PowerPoint that he's going to showcase the work that's being done and talk about. I want you to get to know this team too, because they're amazing. So anyways, I'll turn it over to Matthew. Thank you.
Thank you very much. I want to start by thanking Karen. I don't think there's a recognition of how unique it is. Hospital CEOs don't stick around through bankruptcy and closure and helping to orient the new group that comes into, the what and the where of a new facility. And we are so much further along in this process because of Karen than we would be if Karen had walked away when the hospital closed, which we've been through this before. That's what happens. That's what leadership teams do of hospitals that go through what this facility went through, and Karen has stepped out of this to fail. I'll start by, I'm just going to kind of be the AAM MC here. I'll start by kind of introducing our team. We have Manny. Manny Gahada is, he's our hospital reopening guru. This is his third facility that he's been through the reopening of. Hospitals in California, I don't know if you noticed, but they don't reopen when they close. There's very, very few examples lately of hospitals that are able to be brought back to life. And, I think it's only maybe 4 or 5 in the last several decades in California that have been reopened. Manny's helped do 3 of them. One of the few others is Tulare down in that was an Adventist health facility now. We're just really lucky to have Manny. He hit the speed with which he is moving this project along. He's there every day. I am texting him at 11 o'clock at night and he's still there. So he is putting in the hours and we are making a ton of progress, and I know he's excited to share with you about that progress. Amy McKelly is our corporate COO and provider relations guru. She is helping to coordinate all of the work with the medical staff and reestablishing connections with providers, and she'll share at the end of our presentation about the services that are going to be available as we reopen and then as we grow into the facility. Steve Stark is our CEO for our northern region. He's here to help support us as well. He is over 3 acute care hospitals that we operate north of Sacramento. And then Sam Bular, Dr. Sam Bular is our CEO of AAM. Dr. Singh could not be here today. He is in Louisiana, in Baton Rouge, Louisiana, at an LTAC that we recently took over 4 LTACs that were all on the verge of closing in 4 different states from another operator. And he is there saving and turning around a facility in Louisiana today, but he certainly sends his well wishes. And before I get kind of into our presentation, we are so energized by this community, by the work that these legislators have done for this facility, by the engagement that the state has shown. It is unlike anything I've ever seen. So this is my 2nd year with AAM, I was with Adventist Health for 15 years prior to that. I have been a part of a lot of hospital transactions, been through hospital bankruptcies and reopenings. I have never seen anything like this. From the engagement at the Attorney General level with the work that Esmeralda has done, it's really energizing to us because we see the support coming from this community, coming from the state, and everybody is pushing to get this facility open. And normally, you know, there's a lot of rules in healthcare, and we spend a lot of time, you know, a lot of time and energy in what feels like barriers, trying to work through hurdles that are put in our way. And I gotta say that it's just so energizing for us that we've got people all up and down the state of California that are out there like knocking down every hurdle they can find for us. And it really has been incredible. And we feel blessed to be the organization that you know, has the opportunity to reopen this hospital to this community, and we don't take it lightly, and we are moving very quickly on this project, and I think everybody's gonna be really excited about, you know, your facility when you see it reopen. So, I have a clicker ready. So a little bit about AAM, I'm gonna go quick through this, because you need to know about your hospital, not so much us, but we started in 2012 with Central Valley Specialty Hospital up in Modesto. That is a long-term acute care hospital. I was actually born in what used to be Modesto City Hospital. So my father, who is retired from a career in healthcare, his first job was as the purchasing director in what was Modesto City Hospital many, many years ago. And that facility was the first closed facility. This organization, AAM, started by reopening a closed hospital. And we have been there and kept that open for 12 years now, and it continues to grow all the time. We currently have 13, this will be our 14th hospital that is under some version of either ownership or management by American Advanced Management. 9 of those locations are in California, including Coalinga, that is our closest facility to here. That is another hospital that we reopened from close. We actually opened that hospital in the middle of the COVID pandemic, which even still just seems like it was a terrible idea, but we were able to get that done. The state was really supportive in that as well, and we've been able to keep that facility open and continue to grow the services available there as well. And it's going to provide an exciting connection to Madera Community Hospital for us, as we're all aware of the challenges in how full everything is in Fresno. Our 25-bed hospital in Coalinga really struggles to be able to transfer patients to the Fresno facilities when it's needed. And we're very excited for the connection that we can establish between Coalinga and Madera, and to help, you know, support our own facility to where we're not sitting on patients that really need a higher level of care than is available in Coalinga, and to be able to add volume and you know, more activity to Madera Community Hospital to help it continue to be successful into the future. We are experienced in both urban and rural markets. We have facilities in San Francisco and Modesto, Santa Rosa. So we have some urban experience, and certainly Coalinga, Colusa, Willows, Ridley, some very small rural communities that we're in as well. And we do have experience in the rural health clinic service model, which has been very important to this community and to Madera Community Hospital. So we do believe we're an excellent fit for this facility, and we've felt that all along, and it's why we stayed so passionate over the past 18 months to, you know, fight for our ability to be the ones to reopen this, because we truly believe that we're the right fit for this community, and that our experience is really applicable to what we need to see happen in this facility. Like many of the other healthcare systems, we bring the ability to scale a lot of services. I will tell you, as somebody who's spent time in much larger systems and smaller systems, we do it very efficiently. And, you know, that is to the benefit of this hospital and this community. We're a lean, mean organization, and we're excited to, you know, be really successful in this facility. So the last part that I'll cover here is a little bit about the governance structure of the hospital moving forward. So AAM, we are the operator through what is called a management service agreement. we did acquire through the bankruptcy process, we acquired the real estate. So we are the management service company and the landlord effectively is one way to think of it. As part of the bankruptcy process, the, articles of incorporation, the board, the hospital essentially had to reboot into, what is effectively a new organization through bankruptcy. And as we did that, we appointed a new board of directors to the hospital. And we are, very excited about the group that we have to help govern this hospital moving forward. It is a smaller group than what the hospital had in the past at the governing board level. We are currently at 7 board members. The bylaws allow us to go up to 9. So as we get closer to that reopening and things begin to stabilize and the frequency of meetings is back to a regular cadence, right now we need, that board has a lot of quick decisions to make and has to be very responsive. And so there's some advantages to having a little smaller group as we move through policies and procedures and a lot of quick technical work that the board has to take on right now. But that group right now is Deidre Da Silva, who is our board chair. We're so thrilled that Deidre, both Deidre and Monty are, bring the hospital's past experience and knowledge with them to our new board. And they are historians on the board because of their experience, not their age. And we really are glad that we have them on board helping us, and they know this community, and we're glad they chose to continue forward in their roles with the board. Locke Brar has also joined on as a board member, as a community resident as well. And then we have some folks that are not Madera County residents currently. Many of these people have been in the past, but I wanted to share a little bit about their backgrounds and why they were selected. The governance of this hospital is something where we wanted to make sure that these board members bring specific skills from their careers and their professional lives that are going to benefit this hospital and really, I'll say, kind of make an improvement in the level of technical skills related to managing healthcare entities that the board represents. Dr. Randy Winter is an OBGYN from Modesto. He has family ties to Madera. I believe he actually grew up in Madera, or has family members that did, but he is an OBGYN in Modesto and also was the CEO of a large IPA, a physician contracting entity, and brings a lot of experience both in certainly in the OBGYN field where we are excited for his guidance and how we work to develop that service line over time. And then also the payer landscape. He's very well informed as to how everything works with the insurance companies, with physician compensation, with physician contracting. Dr. David Duncan, from 2019 to 2022, he was the EMSA director for the state of California. And he was side by side with Karen in this very facility in the height of the COVID pandemic during the surges, helping to make sure that this facility was able to meet the needs of the community. And Dr. Duncan is an emergency room physician from UC Davis. And we are just really lucky to have somebody of his skill level at this, helping to support this facility. He was the medical director for CAL FIRE for the entire state and for REACH Air Ambulance for the entire state as well. So just a really phenomenal, asset to this community to be helping support what we're rebooting here at the hospital. Jeremy Lemos is the director of business development at UC Davis Health. Prior to joining UC Davis, he worked for Adventist Health and was actually a part of the reopening of Tulare Hospital. So he brings reopening experience, merger and acquisition experience within healthcare, and lived for about 7 years in Chowchilla and still has his in-laws live in Chowchilla currently. So he does have a strong connection to the community and, really helps us on the, business and the direct connection into that UC health system and, the assistance that can be provided by UC Davis as we expand services into the future as well. And then Dan Garcia is a vice president with Community West Bank and brings a strong finance and lending background to the hospital that will help us, help hold us accountable to solid financials of the facility as we move forward. So we are very grateful and proud of this group that we put together. We think that they're going to do an excellent job of guiding this facility to a sustainable future. And as of yesterday, we actually had a board meeting last night. And at that board meeting, we had to add these bullet points in because it just last night was approved by the governing board. We are also having a community advisory committee. And this was something that was requested both through the Attorney General and the bankruptcy restructuring to make sure that the community has a voice in what's happening at this hospital. There was no further definition around what does that community advisory committee mean. What we didn't want to do is just have a group that meets and has a rubber stamp and doesn't really have a strong connection to the actual governance of the hospital. So we wanted to take some time, and we've worked through with our board that this community advisory committee is actually going to be a formal subcommittee of the governing board with a reporting relationship up through the governing board. And as we expand to 9 members, a member that is from the community advisory committee who also sits on that on the actual hospital governing board to really tie that connection in to the hospital's governing board. So the membership of this group is yet to be finalized. We're going to work with community leaders and many of the folks in this room to help define the 5 to 7 individuals that will make up this community advisory committee. I would be shocked if it's not some of the faces in this room, and we're really excited to get this going and to make sure that the community's voice in both the services provided and what's needed in the future is heard and a part of the governance of the hospital moving forward. The next thing we're going to cover is Manny's going to start to get into what have we been up to? What have we been up to since March when we first got into the facility? And while it may, I think the painting on the exterior may be the only thing visible to most in the room, I promise there's an awful lot more that's been going on. And Manny's excited to share more about that. And we've got a few pictures of the inside, which is, there's a lot going on. So if those pictures don't look tight and buttoned up, you'll understand why. This is very much a work in progress, but as Esmeralda was there today, there's a lot of progress to that work in progress, and we're excited. We think everybody's going to be really pleased with what they see when we're ready to open up your seat.
Good evening. So I'm sure all of you guys have seen the hospital. It's white and it's already starting to fade. So I call this the cosmetic phase. This is probably 10% of what the hospital has to go through in order to open. The real work is here on the board or the PowerPoint. These are the things that are behind the scenes that a lot of people don't know what has to happen in order to open. And a few of the things that have already happened are all the contracts in the hospital have been already negotiated and signed and executed. These contracts will help enable us to do services with companies like Vitalent, which is a blood product company, or agencies with staffing and whatnot, lab companies that help with our lab equipment, or radiology companies. So it's very important that these contracts were negotiated and were in place prior to us hiring employees, because I'm sure that's it's a big concern as far as when we start hiring employees. We'll get into that. Secondly, we have the pharmacy license application submitted. Prior to reopening, we have 7 basic services that we need to essentially license prior to the hospital being reopened. Pharmacy is probably one of the most vital one. Pharmacy license is not one that takes a lot of time, but it's been a long process for us because we're trying to get the pharmacy license as well as the sterile compounding license, which takes a little bit of time to do both of those at the same time. So we've submitted those and we're hopefully going to get that next week. We have the lab license application already submitted. Hopefully we get that next month. We have the CLIA accreditation. This is an accreditation for the lab, which essentially means that all the testing in the lab is done up to code. And this is a third-party accreditation company. And we have to get accredited for all the lab equipment in the hospital as well. And then we have the National Fire Protection testing, which has already been completed. The hazardous waste permit submission has been, actually, this is already done. It's not a submission. We've already have the hazardous waste permit. This happened today. So as you can see, things are moving very, very fast. We have the radiology calibration studies completed as well for all the radiology equipment. Then we have the medical dispensing for all the hospitals, medical drugs, rebooted and upgraded. All the equipment in the hospital has been maintained, calibrated, and tested and ready to use for patient care. We're compliant with equipment inventory log. Our nurse call system has completely been upgraded. We had an analog system from the 1960s that we wanted to upgrade, and that's been done. The telemetry system has been also upgraded as well to meet the current code. New lab equipment is incoming. Hopefully we get it in the next 2 to 3 weeks. And that's been purchased. The hospital renovation, which again is 10% of the opening, is now 60% in completion. We'll show some pictures of what we've done inside the hospital. A little bit what we've done outside is painting, lights. Next week, we'll start doing the parking lot pavement and the sidewalks as well to meet the ADA accessibility requirement. We've already put in palm trees. I'm sure you guys have seen that. So that's happening as we speak. Here are some pictures of our ER waiting room. Oh, I'm sorry. I was looking at my computer. So we have the ER waiting room, and as you guys can see, new flooring is going in, new lights are going in, new countertops are already in a few of the locations. And new equipment will go in those spaces as well. So that's just a little bit what we've done. As you can see, the countertops in the lobby, they're all going to be quartz in the entire facility. And the flooring, the lighting has changed, the handrails, and I believe we've painted that hallway as well, so I can't see from here. Yep. So, you know, Matt calls me the guru. I'm not the guru. I'm just passionate about opening hospitals, and I'd like to share a little bit about my passion. You know, this is after these 3 slides, you guys will all be gurus as well, so you guys can open up a hospital. So we have 3 phases to open up a hospital. Phase 1 is licensing requirements and facility readiness. So in this phase, we work on the lab license, the pharmacy license, the radiology certification, as well as the DEA permit. These are very, very critical licenses and permits and certifications that's needed to reopen the hospital. We need these prior to us hiring employees, because in our scenario, we've failed before. We've hired hundreds of employees and not had our licenses. And then we've had to wait to get these licenses. So this time around, we're making sure that by August, we try to get all these licenses that are prerequisites in order to open the hospital. So you guys can see them up there. And all the equipment in the facility needs to be rebooted and what we call preventive maintenance, PM. So that's all completed as well as we speak. Contracts and service acquisition I talked about earlier, all of them are 100% completed. So phase 1, I would put at 80% as far as completion. We are just waiting on a few of the licenses, and hopefully by mid-August, we're done with this. So phase 2 is our supplies, equipment, drugs, procurement, and hiring. This is the exciting part. When we start seeing employees, when we start seeing supplies in the hospital, we start getting drugs in, essentially getting the facility ready to use. So this will start around August to September, depending on the licenses. So supplies, that means for each department, EVS, linen, drugs, for lab, radiology, you name it. All the departments need to be readily equipped and ready to go. Equipment acquisition. We are getting a lot of new equipment with the hospital shutting down. There's a lot of equipment that was antique, so as you guys can imagine. So now we're acquiring all the new equipment, for example, the OR. There was new sterilizers that we have to get, new scopes that we have to get, new kits for orthopedic surgeries and whatnot. Other facilities would have just opened the hospital, I feel like, with just what we have, because it meets the standard, but we're trying to be above the standard. So that's why we're trying to get everything new now. So when we open, we have a Madera Community Hospital is not just opening, it's opening to the highest standard. So next is drug procurement, fancy way of saying getting drugs in the hospital, right? So that will happen after we get our pharmacy license. We spoke with the pharmacy board this morning. Hopefully by Tuesday of next week, we got our license and we can start ordering drugs. Hiring department directors. So hiring department directors is very, very important for the hospital's success, because us sitting up here, we are not the folks that are going to be caring for the patients. That's going to be the clinical staff. So we have to be very, very careful how we hire our staff, who we hire. So we're vetting our directors now as we speak and hiring staff that has experience and staff that's going to be hands-on. We've had experience where we hire directors that are not hands-on. And with a new hospital, I always say it's a baby. It's a newborn baby, because it's something that is coming to fruition, right? And it's very easily you can affect patient care negatively. So the department directors are going to be the mothers and fathers of this new baby. So we're starting to hire these folks. We've got a few of these departments already lined up, and hopefully by mid-August we have these directors working. I've lost it. All right. All right, so this is the exciting part. It's mass hiring. So our goal is by September, we start mass hiring employees, and this is when the department directors hire all their staff. They get them ready for state survey. State survey, there we have a survey called a Title 22 licensing survey. It's when the California Department of Public Health comes in, they know that we have all the licenses, pharmacy, lab, radiology, everything's ready to go. But now we have to check, are you guys equipped and ready and competent to care for the public health? That is what the Title 22 licensing survey is. So once we hire all these employees, that doesn't mean we can hire them and open. We have to make sure that they're competent for caring for the community, for you guys. So during this phase of mass hiring, we're going to start doing competencies. Competencies mean, are you competent to utilize this ventilator or this IV pump, or what happens in response to a code blue, or if a patient is septic, what happens? So there's different scenarios, right? So they want to make sure that all the staff is competent in these different scenarios in a hospital. So that's where mock runs and preparedness comes. And we will make sure that the month of September going into October, we try to get all the mock runs and our staff competent in that. Regulatory preparedness, like I mentioned, Title 22 licensing survey. We have to build a quality program, because that's probably the most vital piece after licensing, is how do we maintain our quality? So we have to develop quality programs for this community specific. So Karen and I and our clinical team will develop quality mechanisms and benchmarks based on patients prior. So what were some sectors that were failing forward? So now we have to focus on those, make sure those are not delayed. So quality and safety initiatives are very, very key in order to open the hospital and keep it safe. I think that's it for me, but I just wanted to say one last word. You guys all stood up for us. I really appreciate that, but we are standing here for you and working for you. So we should be the ones standing up, and thank you guys. So thank you guys.
Hi, everybody. My name is Amy McKelly, and as Matt had introduced, I am the Chief Operations Officer for our corporate AAM. This isn't about me, but I do want to give you a little bit of my background because it's important. Our organization primarily is managed and operated by clinicians. So we are the people who take care of patients. I started with this company when a rural health hospital where I live, which is up in Northern California, it's called Colusa Medical Center. That was a neighbor of mine, and that hospital closed down, and it was very devastating for the community. I had friends that worked there that lost their jobs. I knew people that died because they didn't have a hospital there. I come from a farming family, and we are a farming community. And so when I heard about this crazy doctor who owned a company who thought that he could come in and open our closed hospital, I left the big hospital that I was a hospitalist at and thought, I want to join this company. I want to join these people who think that we're worth something in rural health, that we are worth something in farming communities, and that we deserve health care. And about 6 years ago, I had the privilege of being at the Capitol, and we were talking about rural health, the challenges in rural health. I was in a room similar to this of about 300 people, and the speaker asked, has anybody here ever been part of reopening a hospital? And out of those 300 people, I was the only one who could raise my hand and said, we have. We reopened Colusa Medical Center. It has been reopened since 2018. It is flourishing. We expect the same for Madera. And Manny is very modest when he talks about reopening a hospital, because as you've heard a little bit, it's not just going in and flipping the lights back on and turning the equipment on and restarting. When you are a closed hospital, every regulatory agency expects you to be a new hospital when you reopen and you meet today's standards. So we're working very hard to give you guys a new hospital. My role within the company is in clinical operations for the most part. So I have the privilege of working with all of our doctors, our nurse practitioners, our allied health professionals, and bringing them back to our hospitals. In every other situation that I've worked in, it's been very hard to try and get the doctors, the professionals, the nurse practitioners to come back. In this situation, it's very different. So about 1.5 years ago was our very first meeting with our community physicians here. Thank you to Dr. Ashraf, who had helped set that up. We have been meeting with about 30 local physicians for over 1.5 years now. And rather than me having to make anybody to come back, they're all saying, when do I get to come back? And so I do want to implore to the group here that when we do reopen, I really hope that you all come and support not just the hospital, but our associated clinics. It is very important to a hospital that they have strong clinics, as well as the strong medical services within the hospital. And so, I don't know how to work this out again. Okay, thank you. When we reopen, we are going to open as a basic emergency department. That is exactly what Madera Community Hospital had before. I don't like that it's called a basic emergency department because it is much more than a basic service. Very small hospitals like Coalinga have what's called a standby emergency department. A basic emergency department is actually quite complex, and there are quite a few regulations that go into the services we have to provide. So we are required to reopen, obviously, with emergency medical services, intensive care services, laboratory, radiology, on-call emergency surgical services, which not only includes the surgeons, but the entire staff has to be on call, the anesthesia on call, and blood bank services so that we can respond to emergencies. Other specialties that we've already been collaborating with and expect to come back and newly join Madera Community are emergency medicine, critical care, pulmonology, cardiology, dermatology, gastroenterology, general surgery, anesthesia. I'm sure you all can read. You don't need me to read all of these for you, but we're really excited about some of these specialties because they weren't in Madera before. Infectious disease, which I think everybody knows had a huge part in COVID, but does a lot of other things like valley fever and hepatitis and a lot of things that we need here. Neurology, orthopedics, rheumatology, clearly women's health and internal medicine, family practice, pathology, pediatrics, podiatry, and neurology. Which fund? In addition to the services that we will reopen with, so everything I just showed you on that prior slide, we will open with from day one. We have big aspirations to provide additional services to Madera. So the first one that we would like to bring in as soon as possible will be interventional radiology. Interventional radiology does things such as biopsies, they do paracentesis, they drain fluid from the lungs, they do a lot of things to support dialysis patients and things that I understand have had to be sent out of Madera before to Fresno. We will be providing in Madera. Oncology is one of the next ASAP things that we certainly will be bringing in. Wound clinic, endocrinology. We really look forward to working with behavioral health because we are very strong proponents of treating substance use disorder and mental health within our emergency departments and making sure that they're hooked up with community resources afterwards. Pain management, and for specialties that we don't have available in Madera, we will create a strong telemedicine program so that we still have access to those specialties without people having to travel. In the future, we have aspirations to really provide life-saving local interventional cardiology. This gentleman could speak a lot more to what interventional cardiology is, but that is basically saving people's lives who are having a heart attack, offering something called cardiac catheterization when they're having acute heart attacks. We also want to provide some cardiothoracic surgery, which will support the cardiac program, and partnering with the medical schools within our aspirations as well. And we already have pretty strong contacts with at least 2 medical schools. So I think that I have, out of all the hospitals that I've been part of reopening, like this is the best experience that we've all had, because opening a hospital is so much harder than I could even explain to any of you guys. When Manning talks about this application's done, that application's done, what he didn't say is some of those applications and supporting materials are 140 pages long. And typically they may take 3 or 4 or 5 or 6 months to be approved. With our legislators' support, the Attorney General's support, it's happening a lot faster for Madera than any experience we've had. And this is the first time we've had such an engaged community, and that is the best part. We feel very welcomed. We feel very welcomed here. We look forward to serving you all. We look forward to working with some of you again. And I thank you for your time.
You know, I thought I was emotional when the hospital closed. I think I'm almost as much emotional, more emotional now than I was then, because I'm so grateful that there is a group of leaders and people who care to come into Madera and really establish quality healthcare in Madera. So thank you so much. Dave disseminated a lot of information, and so I hope that you're all very, very happy with what you've heard. We are going to open it up for questions. So do we have somebody that have a microphone here? Is there anybody that has any questions? Santos.
Yes, good afternoon, and thank you for the opportunity. I usually don't use a mic, as you can tell. To answer 2 of my questions, and I want to thank you for your in-depth presentation. That's quite a bit of information and very positive information for us, because a lot of the community wanted to know the information about what this meant to reopen the hospital. And you give it a detailed explanation. It's tremendous. Now, you answered 2 of my questions already, and so I'm not going to go into those. And one of them was about the board, the advisory board and the regular board. And I'm heartened by the fact that you're thinking of not only creating an advisory board that can actually function as a real, but you also have the possibility of expanding the regular board. And I was just thinking, if you give me a call, I can be right down. Shameless plug, yeah, I know, I'm a politician. So a very basic question. You're gonna be doing hiring, and there's a lot of folks who left and would love to come back. Are you gonna be looking at prioritizing them and hiring them, and I know you're gonna find tremendous people out there who did not work here before. But if we can look at hiring local, that would be a tremendous act for the people of the community who have suffered because they lost their jobs. They got a pink slip and said, no longer work here, go back to Brady. Thank you very much.
Yeah, thank you, Mayor. In regards to prioritizing staff, of course, Madera Community staff would be the first we want to hire, but we want to be very careful because we're hiring for our patients, right? So we want to prioritize competence over location. So that is our number one goal. Of course, if they're from the community and they have the competence and the skill set, they will be hired.
Other questions?
Ours is just, via Zoom, so we did have a community member ask us, where could the community apply for positions?
We're gonna have open houses starting next month. So our number one goal is to try to see staff in person. And we'll publicly announce that on our website. And we'll also have Indeed and Vicus. Yeah, I think it's Vicus. So we have an agency called Vicus. What they do is they post positions to Indeed, to Glassdoor. So you'll be able to see those start in August. And most importantly, we'll have open houses. So you can walk in and give your application for these select jobs.
No, it was just that one from Zoom. Yeah. Then we had a.
Does anybody else have a question? Okay, give me 1 second. I saw the in the blue, if you'd like, I will be repeating the questions on the mic for our interpreters and then I'll pass them back to our panelists.
So I have a question, other people were able to come, so I'm asking on behalf of them.
Sure.
I think that the biggest concern that people have that live here is, what are we gonna do differently so that we don't end up in the same situation that we had?
So the first question is, what are we going to do differently so we don't end up where we once were, correct?
So more specifically, the question that my friend has is, are you going to hire an accountant with hospital experience and a good billing team?
So will there be an accountant hired with prior experience with hospital billing? Is that person going to be hired? Here it comes.
I'm gonna take the first question. So my name's Steve, and I'm one of the newer members of AAM. I was at the hospital in Ridley, California, which is Orchard Hospital. And the question was, what will we do different to maintain healthcare in Madera, different than what we did in the past? And there's 2 or 3 things that we've experienced at Orchard Hospital that's made a vast difference because of our partnership with AAM. So prior to us joining AAM, which was in July of 2023, we really didn't have an engaged set of providers that would admit patients. We were transferring everything out of our community, which then created financial challenges to where you couldn't hire staff. So our census just continued to drop. Not only that, we as a single independent hospital were really unsuccessful in negotiating good payer contracts. So when we did get patients, we weren't getting paid even our costs. And so we saw ourselves spiraling down the same path Madera Community Hospital ultimately went down. Today, I'm happy to report in just the roughly 1.5 years, we've had about 14 months out of 18 that's been profitable. Our hospital went from an average daily census of about 40% capacity to where we're at 90 and 95% capacity all of the time. We brought staff back that we had laid off. We've recruited new physicians and new providers that care for the community, the providers that we have in Madera. So really, the things that I see us doing in Orchard Hospital are already the strategies that we're talking about and implementing at Madera Community Hospital.
I'd like to add just one thing from the clinical perspective, actually two things. One thing that we're doing differently is truly mandating the medical staff focuses on patient quality care. So we've heard a lot of stories in the past, just like Steve pointed out, that patients were not being admitted to their own hospital. They'd be seen in their ER and then they'd be sent to another hospital. We are really encouraging our doctors to admit our patients locally. And the other thing is to have a place that you guys are all proud to come. I don't want you to come to Madera Hospital and feel like I'm only coming here because this is all I've got. You're coming here because it's an amazing place to receive care.
So there was also a question about billing, and that is one of the, big advantages of, being part of a system is we have centralized billing offices. We have billing folks in Sacramento, in Stockton, in Modesto. And it is something we do very well as an organization. We make sure that we code properly, that the documentation is all done properly, and that we're getting paid for the services that are being provided. And that is it is a really difficult thing for one standalone hospital to try and be really good at, because it takes a lot of experience, and we're confident in our ability to bring that skill set to this facility, just like we have many others. And I think it'll make a big difference. And then certainly I don't know if anybody in here works for any of the local insurance companies, but this facility struggled with its rates. It just really, whether even Medi-Cal, which may feel like something that's the same for everybody on what the hospitals get paid, this facility got paid substantially less than all of the other facilities in Fresno and Merced. That is something that was actually recognized by the Attorney General even as they reviewed this transaction. You're basically in every other AG, set of requirements for a hospital transaction that's ever been put out by the Attorney General in California. They specifically prohibit you from trying to negotiate your Medi-Cal rates. They specifically said this hospital needs rates equal to what the other facilities in the area have, and they can do anything in their power to go and get those, which, is going to be huge for this community and this hospital. The other thing that we're counting on is certainly, hopefully, we don't have to do COVID again, because that was very difficult on this facility and many others. And, we are optimistic that we're opening it at the right time with the right set of services and the right support from AAM to make sure that we don't find this facility back in the financial troubles it was in.
I got one question.
Actually, I want to go in order. The gentleman with the black t-shirt, is that okay, or? Okay. Question.
When we go open up the hospital?
When are we going to open up the hospital?
The $1 million question, the $57 million question. So I think, our answer to that right now is, I would say Q4, right? If that narrows it down to a couple month range. And I'll share an example. If everything goes great, October. I think October is possible if everything falls into line. I'm going to give one kind of lengthy technical example because I think it helps illustrate what's in front of us and the challenges of reopening a hospital. In the lab, there are obviously lots of large pieces of equipment that perform all these different lab tests. And one of them is called a chemistry analyzer. And that piece of equipment happens to weigh about 1,000 pounds. The one that is in the hospital is not that old, but it's on the older side. And Beckman Coulter is the company that provides all of the lab equipment in the hospital. All of that equipment is on a lease. That's how every hospital runs. the company leases you that equipment for not a lot of money, and they make all of their money selling you the reagents that perform those lab tests. That's kind of how that business model works. They don't want to come service an old machine. They would like to come in and put in a new machine. Well, a new chemistry analyzer weighs also about 1,000 pounds. Any piece of equipment that goes into the hospital that weighs over 400 pounds requires a full seismic, what's called OSHPOD, clearance for that piece of equipment to be installed, which means an architect has to come and basically decide how does this thing need to be bolted to the floor, and an engineer has to decide whether or not that 1,000 pounds compromises the integrity of the entire facility. And that process alone can take, that HCI OSHPOD review process can take 4 to 6 months. So that one piece of equipment, you know, can basically have a 4 to 6 month impact. We have negotiated with the provider, with Beckman Coulter, to come in. Luckily, that machine, thanks to Karen and the team, was shut down properly. They ran very specific chemicals through it. They did everything they could to make sure that this 1,000-pound machine turns on and works again. But it is older, and we've had to really push the vendor to say, look, we're fine with a new piece of equipment once the hospital's open and it's not causing a delay to bring in that new piece of equipment. But we desperately need you to come make this piece of equipment work, because we can't wait 4 to 6 more months. And it's taken lawyers and bankruptcy court action just for one piece of equipment in the lab. So that is kind of the work that goes on behind the scenes. And we will say, you know, we believe it's possible by October. We're willing to try and commit to Q4, but understand that we may be back here in a month telling you about a different piece of equipment that we weren't successful with on, you know, trying to get it, and there may be a delay. But just know that we're going to do everything in our power to hit you know, certainly before the end of this year. And with everything we see in front of us right now, you know, our target is the month of October. But just I hope that one kind of illustration showed how fragile this process is, and we're doing everything we can to, you know, to go as quickly as possible.
Yes, the gentleman in the back.
How is that all doing? Are they successful, or you know, have you learned along the way? You roll of thumb to protect yourself? You never did say the success rate of all that.
To sum that up, the question for our interpreters was, what is the success rate of the other clinics and hospitals that our new management company manages?
All right, so I'm going to start out by asking this group of people here. Steve can't vote because he wasn't with us when we first started talking about Madera. Raise your hand if we said we would never open another closed hospital. So the only person that you don't see here is Dr. Singh, who you mentioned, who is in Louisiana. All of these people, when we said, are we going to go open a closed hospital, all of those hands on the no vote were raised. There's one of them who happens to be, you know, the most important vote, Dr. Singh, our president, who said, nope, we're going to do it. We have to do it. They need it done. We're the right group to do it. We've done it successfully before. And sorry that all of your hands are raised on the no vote, but we're going to do it anyway. And I would say that Calusa probably shouldn't still be open because of how difficult that was and how many lessons we learned the hard way reopening that hospital. And each time we've done this, we've gotten better at it, and we've learned a lot of lessons about what to do. Calusa does not lose money anymore. I don't believe any of our facilities at the moment are requiring a subsidy right now. But in general, you know, we have some facilities in our portfolio that do very well. And we have some, you know, Kalinga, for example, Kalinga doesn't make much money, but it doesn't lose much money. But we're just happy to be able to provide the service to that community, and we don't have an expectation that, you know, that facility has to deliver a certain financial performance. As long as it's sustainable and we can keep the doors open, that's our goal. And we do have other facilities in our portfolio that, you know, that do generate the margin that allows us to invest in projects like this. And, you know, our goal is certainly that we get Madera to a place eventually where it is able to generate a margin to reinvest in itself and to be able to keep up modern equipment and to add services. And if your hospital, you know, breaks even or loses money, it's really difficult to invest in those services and to grow and to expand the hospital. So, you know, we're not going to rest until this hospital is producing a margin that allows it to be sustainable and continue to reinvest in services here.
So I do want to quickly acknowledge that we are over time. However, I know that there are still a lot of questions in the audience that we do want to give audience members the opportunity to ask. So I just wanted to acknowledge that again, we are over time. However, if you can raise your hand and I will try my best to sum up your question, and then we are going to take about 2 more from the audience, and then I have some on Zoom. And I did see your hand up first, ma'am.
I'd just like to know, in regards to the lady's question about billing, how are the insurances going to provide ample information to a lot of the, you know, residents here of what they cover, what they don't cover, so that we're not blindsided by different entities? Just, you know, the openness of insurances, what you take, what you don't take, low income, HMOs, that whole gamut.
Well, you've summed up quickly the complexities of modern healthcare insurance, and you know, you've got various payers in Madera Community Hospital. You have commercial for the jobs that are created. You've got the lower, the people that are lower income that are getting Medi-Cal. You've got the 65 and older or disabled people with Medicare. And then the mix of managed care is all in the middle of all that. So our goal at Madera Community Hospital is to partner with payers that represent the population of Madera Community Hospital. We want to target the large employers and the small employers that carry commercial insurance plans. There are certain requirements that we have to contract with the government payers, such as Medicare and Medi-Cal. And so our goal is to provide all of the services that the community of Madera needs. For Madera Community Hospital to be successful, we rely on everybody in this room to support the hospital by coming and using our services. And if it's a service that you need that we don't have, we need to get it. And that is how small community hospitals survive. We can't survive without you. And I know that it's a tragedy when a hospital closes, just like it did here and just like it did in Coalinga, just like it did in Colusa, just like it did in Modesto, that people's lives get lost for that. So our goal is to provide the services that you need. And then we've got a team of people that are experts at negotiating contracts with payers to make sure we can produce a level of service that meets high expectations, but also so we get reimbursed adequately so we have a viable healthcare system for Madera for decades to come.
Was there a question? I know I've kind of been ignoring this side. Any questions on this side of the audience? Yes.
Buenas tardes. Voy a hacer mi pregunta en español, ¿está bien? Sí, está bien. Okay. Mi nombre es Ángel Noriega, yo vivo en Fresno, pero tengo muchos amigos y amigas en esta grandiosa y hermosa comunidad de Madera. Aquí hay una comunidad muy grande asentada de personas de origen oaxaqueño, originarios de Oaxaca. Ellos usualmente hablan su lengua, xilteco, zapoteco y tiqui. Y me gustaría saber si este hospital, en primer lugar, qué bueno que van a reabrir, felicidades. Segundo, si se pudiera considerar a estas personas que hablan estas lenguas, que pudieran tener algún intérprete, ¿no? Para cuando van a los médicos. Lo otro que quería saber, o me gustaría saber, es si los empleados de esta nueva instalación de hospital van a tener derecho a estar sindicalizados. Gracias.
So his first question was, we do have a large population here in Madera of Oaxacanos, community from Oaxaca, who speak indigenous languages, Mixteco, Zapoteco, Triqui. And his question was, will there be interpretation services for our indigenous community in those languages?
Yeah, hi, yes, absolutely. We've always offered different languages at Madera Community Hospital. We'll continue to do that. We try to hire people that can actually speak the languages of our community. And if we can't hire the employees that can speak those languages, we also have some tele-language services available so that we can meet all the languages that come in to our community. I don't know if somebody has to translate that.
She translates. Okay, and I'm gonna go ahead and move on to our question on Zoom.
He had a second question was, will the employees be able to unionize?
Yeah, so that's not something any entity can dictate, right? That's up for unions are up to the employees, right? So that's an entirety of in the labor court, we can't say yay or nay, right? So for labor court purposes, that's up to the employees.
And our last question, we are gonna be taking it from Zoom. Can you share about maternity ward? Are we going to have one?
I would have been disappointed if this question didn't get asked. So we are not opening with obstetric care available at the time we open the hospital. We are going to work to provide prenatal care through the rural health clinics right away and work to build a patient base. You know, one of the differences between obstetrics care and most other things that take you to the hospital, there's like a 10-month lead time, right? If somebody has a orthopedic injury and shows up at the emergency room, there's about a 10-minute lead time to that person showing up and needing care at your hospital. For OB, there's obviously a long lead time. We have to build up a patient base that utilizes those services. It's also functionally like opening a hospital inside of a hospital. It's an entirely separate set of staff. It's a separate unit in the hospital. I will tell you, those beds are not being repurposed for anything else. We are maintaining that unit in the hospital right now. We are focused on, you know, opening the emergency room and the services that Amy described as we open the facility. We know that Esmeralda and others are working hard at the state to try and help make sure that the reimbursement aligns to the costs of those services. When I described that, you know, it's separate nurses, separate OR, you have to maintain a separate OR with separate anesthesia that covers just that one unit. It's not paid any differently than anything else. In fact, it's paid worse than most things in the hospital. So it is a real challenging service, you know, to operate sustainably. With that said, we do believe that this community has the volume, enough deliveries to support a unit. There are smaller communities where, you know, if you're doing 200 or 300 deliveries a year, that's really not a particularly safe program. You know, OB units need to be 800, 900, 1,000 plus deliveries a year to be really safe units that are well practiced, that can take all types of deliveries that are coming. And we do believe that in the future, this community has proven at this hospital in the past that it can you know, have that level of volume coming through obstetrics. So it is absolutely will remain in our, you know, the front of our minds as to how to deliver that care and do it in a sustainable way for the community and the facility. It is not going to be something that we open with, but we will, you know, we expect that that community advisory committee is gonna keep on us and make sure that we're continually evaluating our ability and, you know, the financial resources that it will take to deliver that service.
I know that there were other questions, that came into Zoom, but we are beyond the time limit. Is there a blog or any other opportunity for people that do have questions along the way that they have access to presenting those questions to you? Without expecting an answer within 5 minutes in return. Please.
Yeah, like I mentioned regarding the staffing and hiring, we're gonna be rebooting our Instagram, Twitter, Facebook, and especially our website. You'll see that starting August 1. There'll be message boards where you can message and they'll directly come to us. That'll probably be the #1 way to reach us, if not walking in the hospital. You guys can come find me anytime.
And I apologize if that put you on the spot, but I mean, I'm excited that these people have such great questions. I think you've really proposed some great questions that to me show wonderful support. So, however, if you really need your question asked tonight, you can always block the exit and not let them go out until you got your questions answered. Again, thank you to the Coalition for Community Justice and staff. Legal assistance, all of our speakers this evening. AAM representatives, thank you so much, but most of all, thank all of you for hanging in there. Good night, everybody.
For anybody that was using interpreting equipment, please leave it on the tables and we will go ahead and pick those up. Para ustedes que estaban usando el equipo de interpretación, por favor, déjenlo en las mesas y los vamos a recoger en unos minutos. Gracias.
We get that right.
Buenas noches, muchas gracias. Good night, thank you everyone.